Assalamu alaikum, me Akan Abdu Akan Astain. So in today's video, I'm gonna go through the surgery 22nd May afternoon paper. So let's start. Insulin mechanism of action is via the tyrosine kinase pathway. The good doctor will treat patients well if do active listening to the patient. Vitamin A as the prophylaxis given to a child is an example of specific protection. Oropharyngeal carcinoma caused by which organisms, that is HPV. The patient has damage to a nerve coming out from the dorsal surface of the left side of the brainstem, which will be the defect in the patient, that is the left sided loss of intorsion. The patient went to the dental surgeon for the excision of the low teeth. After that procedure, patient developed the numbness of lower lip. Which nerve is responsible, that is the inferior most medial in the popliteal fossa is the popliteal artery. Which muscle drive from the first pharyngeal arch, that is mylohyoid. The maximum aortic pressure in which phase of the cardiac cycle, that is reduced ejection phase. The semilunar valve opening is seen at which phase, that is the rapid ejection. Next, the low grade follicular lymphoma translocation is which of these, that is the 14 ratio 18. Local lymphatic obstruction is caused by the combination of which two, that is the infection of the neoplasia and lymphedema. Lymphatic obstruction is caused by the infection and the fibrosis. The bronchogenic carcinoma behind the root of the left lung causes compression of which structure, that is the vagus nerve. The couple married 2 years ago, female didn't conceive. Her menstrual cycle is normal. The phase which indicate the ability of a girl when ovulation start is the Menarche. Association of HLA-B5 is the Beckett's disease. The mother has alcohol during the first trimester of pregnancy. Baby is at the risk of developing prematurity. The carbonic anhydrase is present in the cytoplasm of RBC. The girl gave birth to a still birth child. Carbogeline suppresses the lactation by decreasing prolactin by which action on the D2 receptor agonist. Which one is diffusion limited gas, that is the carbon monoxide. Next, the slow growing thyroid tumor is the papillary. The next ACTH producing tumor is the oat cell carcinoma. On histology shows flask shaped cells, multiple dendritic synapse in the cerebellar cortex. The patient with the tip of the tongue carcinoma, first drainage of the lymph node will be the submental lymph nodes. Submental lymph nodes. The anterior to tongue general sensation is carried out by the trigeminal nerve. The depression of the parasympathetic, the patient causes the increased heart rate. 30-year-old man sustains a left femoral fracture in a skiing accident, and his leg is placed in the plaster cast. After the leg has been immobilized for the several weeks, the diameter of the left calf has decreased. This change is most likely to result from which of the following alteration the calf muscles, that is the disuse atrophy. The small child had the exchange transfusion as the hemoglobin were decreased. After that, slowly his ear become red, then trunk, then whole body also had the diarrhea, jaundice, and D-range LFTs. He is basically having the graft versus host disease. Next, the patient has given injection penicillin, after we developed the shortness or bronchoconstriction. The immediate drug must be the adrenaline. 60-year-old male with the splenomegaly, inguinal lymphnopathy, Sternberg cells, blood showed lymphocytes eosinophil. That is the Hodgkin stage 3. The doctor did auscultation of the posteriorly inferior limit of the lung, which we call posterior inferior lobe, that is at the level of the T10. The patient has the liver cirrhosis. Route of the hepatic biopsy is the T10 mid-axillary line. During suprapubic catheterization, a transverse incision is given. Which of the following is most likely to be damaged? There is the inferior gastric artery. The gastric carcinoma involving the left upper side of the stomach will spread first to which lymph node? That is the pancreatosplenic node. The person doing chin up raises his arm above the head and then bring rod in front on the chest. Which muscle will help? That is the latissimus dorsi. The tubular structure with the small lumen and the transitional epithelium with the 3 layers of smooth muscle and the outer wall developed adventitia related to the ureter. The hepatic patient present the OPD, the ooze greenish discharge from the wound, that is the pseudomonas upon upper esophagus, supplied by which of the following? That is the inferior thyroid artery. Next, the lipophilic hormones act through which of the following mechanism? That is messenger RNA, which is necessary in the G1 for the next phase to occur. That is the DNA synthesis. Early adolescents with a prominent forehead, everted looking ears, and the long longitudinal mandible and enlarged testes, that is the Fragile X syndrome. Which of the following supply the suprarenal gland, greater thoracic subclavian nerve? The tight cell of the adrenal gland parenchyma is derived from the mesothelium. The male in the OPD with the 104 few lost 4 days history of intramalarial. She has been passing cola unit for the last 1 day. LFTs increase unconjugated bilirubin. The cause is G6PD antibiotic act on the bacterial cell wall that is the penicillin. Which hormone always acts through cyclic AMP second messenger system that is the TSH. Female is not fertile. Went for the ultrasound. Radiologist noticed some structure behind her ovarian fossa, which the following structure is seen, that is the ureter. Squamous cell carcinoma is associated with the nets of the keratin pulse. Man's spot of the pelvic viscera is elevated. Now the meningitis in the newborn of the 48-year-old is caused by the Escherichia coli. The structure passing through the fossa ovalis is the great saphenous vein. Next is the penetrating chest trauma just to the right of the medial sternal border at the fifth intercostal space is pericardium, and the heart was injured. Which chamber is affected? That is the right atrium. The person with the hypertension and the raised ICP, which one of the following will decrease? That is the heart rate. Cause of kidney stones in the vitamin A deficiency, the atrophy of the renal parenchymal mucosa. Which anesthetic drug will increase the heart rate? That is the pethidine will increase the heart rate. Next, the trigoon of urinary bladder derived of which of the following? There is a mesonephric duct. Next, the blood group has which blood group has which of the following? There is a NTB antibodies. The Tishner's muscular dystrophy defective gene makes the cell impermeable to which of the following? There is albumin. The person awake from his sleep and starts walking. This is termed as the somnambulism. Next, the chronic villus sampling done at which weeks? That is 11 to 12 weeks. The thiaziditics act on the early distal tubules. Heat produced by the muscle in excess of resting heat during concentration during contraction is that is the initial heat. For transplant, best cell for the HLA typing is the white blood cell. Next, referred pain from the ureteric colic is felt in the skin of the scrotum due to the involvement of the following nerve. That is the genitofemoral nerve. The medial arc of the foot is plagued by which ligament? There is a calcaneonavicular. The female with the oligomenorrhea karyotype 46X nullo associated feature is the gonadal dysgenesis. Next, the group A streptococcus is related to the M protein. The thyroid hormone increase free fatty acids. Regarding erythrocytes, true is increased viscosity of the blood. The person got ankle injury result in the damage of the medium malleolus and deltoid ligament. This occurred due to which of the following? There is the excessive version of the foot. The lady with the cervical cancer of the 3.5 centimeters slabs and the lymph nodes are enlarged with the suspected metaplasia. The staging of this would be the T2N1M1. The vaginal epithelium is stratified squamous epithelium. What is the present? Along with it, there is a high elastic fibers in the lamina propria. The fetal heart differs from the adult heart by the fused endocardial cushions divide right and left atrioventricular canals. The former presented with the migratory linear lesion on the foot. There is a cutanea lava migrans. The type of hypersensitivity in the SLE is the type 3. The student went for the hepatitis B vaccination. He has anti-HBC IgG positive and HBs negative, anti-HB negative, anti-HBs antibody positive. This is basically the immunity against the previous infection. The few days old newborn presented with abdominal distension and the vomiting was diagnosed as a case of Hirschsprung disease, in which there is a complete absence of parasympathetic ganglia. These ganglia receive preganglionic innervation from which segment of the cord? There is S2, 3, 4. In erythroblastosis fetalis, the type of hypersensitivity would be the type 2. The ventricles filling is represented as the TP segment. The iron present in the ferrous form in the ferritin. The young patient blood pressure is 150/95. Serum renin is higher than normal, which the following stimulus for the increased level of the renin? That is definitely sympathetic stimulation via the renal nerve. The 86-year-old girl presents the OPT with excessive facial and the chest hairs. Adult size extends gently and deepening of the voice. She also gives history of the two siblings' death suffering from same condition, which enzyme deficiency leads to this 1 hydroxylase deficiency. The child suffering from the infection sent his blood for the histopath. There were Wathan Fincatelli giant cell present in the slide. The condition is the measles. Next, the rotational movements of the head is by the sternocleidomastoid scalenes interior. Active sodium absorption occurs in which phase of the kidney? Which part of the kidney? There is a proximal convoluted tubular. Most superficial content in the adductor would be the femoral vein. Next, an injury to the head of the femur occur at the foramen ovale will lead to the loss of sensation of at the lower face. Next, the relation of the right vagus nerve with the trachea while entering is the direct contact contact. Next, the female patient, known case of invasive ductal carcinoma with the lymph node involved. Why it is called the invasive skin involvement? The vessel is cut posteriorly of the epiphyseal foramen filled with the blood. Likely involved vessel is the inferior vena cava. Next, the level of the accessory nerve in the posterior triangle of the neck is the above point. Regarding the bronchial asthma, the most probable finding would be the FEV into FVC ratio less than 75. The patient had the stroke and now on the Doppler has increased blood flow. What is the reason for this increase in the cerebral blood flow? The increased perspiration. The mother bring her child who is reluctant to drink water and has muscle spasms. She gave history of the nail puncture to his toes. The likely cause with the neurotoxin, the endotoxin of the gram-negative bacteria is present in the outer cell wall layer. Which hormone always acts through cyclic AMP secondary messenger system? That is the TSH. Next, the cyclic AMP secondary messenger system acts through the receptors. The nosocomial infections can be prevented with the nerves by the proper hand washing. The female with the shortness of breath, fluorescence done. Flood having a specific gravity of 1.006 cause would be the CHF. Next, the A wave correspond to the PR segment. The patient with the right-sided hemiplegia, left-sided pain, and the temperature lost below T8, while right proprioception and the touch sensation lost below T8. What is the cause? The hemisection at the T8. Next, in atherosclerosis, which part of the vessel affected the most? Elastic fibers. A child presented with the dark colored nappy, dark urine, the homogenistate oxidase deficiency, which likely cause there is alkaptonuria. Which of the following is an autosomal dominant disorder with the tumor mutation? Familial autonomous adenomatous polyposis, forced expiration mainly through the internal intercostal. The fatty person has a history of hyperlipidemia. Whatever the type is dangerous for the heart. That is definitely LDL. The vessel at the base of the bladder lies in which ligament? There is the dorsolateral. The Pakistani student got scholarship abroad for which he is required MTB test. How are the TB macrophages different from the normal macrophages? They are the phagocytosis. The male with the normal size skull and the trunk and short extremities. Musculoskeletal growth occurs in which of the following genetic diseases? There is the achondroplasia. Epinephrine receptor on the adrenal medulla is B2. The complete denervation of the small intestine would be expected to that is the increase the resting rate of the intestinal peristalsis. Next, the male alcoholic and the gutka eater develop non-healing ulcer. He is prone to have the squamous cell carcinoma. The newborn is brought with the lumbosacral swelling containing meninges without neural tissue. What is the most likely diagnosis of this swelling? There is the spina bifida, meningocele, anterior dislocation of the femur on the tibial ligament. Damage would be the posterior cruciate ligament. That is the chronic liver disease will have the decreased albumin, more cell division enzyme involved in shortening of the DNA. That is the telomerase. Next, the thyroid hormone receptor present in which of the following? There is inside the nucleus. Man waiting for the bus from 60 minutes in the moderate hot environment. How body will regulate the temperature? That is the cutaneous hyperemia. 48-year-old woman presents with a fever from the 3 days. She also complains about the urinary frequency besides loin flank pain. TLC is 35,000. What is the next basic step? That is urine and the blood culture. Biostatistics deal with the analysis and interpretation of the data. Next, 1 to 2, the patient posterior dislocation of the elbow, which of the following ligament is damaged? The ulnar-collateral ligament. The patient present with the subcutaneous bleeding, TK, onychomosis with the coagulation profile and CBC. Normal diagnosis would be the vasculitis. The patient present with the fever, decreased blood loss and bloody diarrhea, peripheral blood symptoms, schistocytes. That is the HUS. Next, the patient has the tingling sensation in the peripheral body and the lab investigation raised MCV. The diagnosis would be the vitamin B12 deficiency, which of the following is not at the greater trochanter? There is a gluteus maximus. Next, the result of the positive test came positive, negative came negative. This is related to the accuracy. The medial attachment of flexor retinaculum is the pisiform. A young man was thrown off the motorcycle in the traffic accident. He landed on his shoulder. On examination, his upper limb was hanging by his side and he had lost sensation on the lateral aspect of the arm. The most likely damage would be the axillary. PPT tuberculin test done to patient after 40 hours. 15 arrhythmia is noticed. Responsible for the arrhythmia cells would be the CD4 helper T cells and the macrophage. Adrenal gland release secretin with the help of which receptor? That is the nicotinic cholinergic receptors. The patient has the internal jugular lymph node biopsy in the neck region. After that, he developed the dumbness of earlobe. Which of the following nerve got injured? That is the greater auricular. 133, the right shift of oxygen dissociation curve is caused by the decreased pH. The man unable to hold a mug of coffee and image draw on the shoulder and hand movement of which part of the brain, that is the premotor. The young male had an RT with the result in the femur fracture. He died 5 days. The autopsy shows the cerebral petechias. Diagnosis would be the fat embolism. Pregnant lady with the labor pain and obstructed labor was taken to the hospital but died before in the hospital. Most likely cause would be the amniotic fluid embolism. Next, 137, the patient is having nystagmus which are cerebellum is affected. The flocobolural, what is this? There might be some mistake here, typing mistake. Right ventricular pressure at which pulmonary valve open is the 8 mm of Hg. The common primary immunodeficiency is the IgA deficiency. The cell was on the microscopic examination. Large mitochondrial densities are found indicating the irreversible cell injury. The patient in the 40s present the dilating torsion superficial vein, no abnormality present. What is the cause? There is incompetence and complete closure of the valves. The edema ascites, the liver patient, is due to the decrease in cardiac pressure. The patient presented with the headache. ESR 120 causes polymyalgia rheumatic associated with the following condition: the giant cell arthritis. The patient has emphysema, which will be acid base imbalance present in him. There is a raise in the plasma participation. Carbon side, the drainage of CSF occurs in the arachnoid granulations. The fracture of the head of the femur lead to the vascular necrosis of the head artery. Involved is which of the following? That is the medial circumflex artery. The most common feature in ischemic injury, cytotoxic cell injury, and the burn injury is the ROS production, reactive oxygen species production. The neoplasia has the parenchyma microenvironment. Microenvironment has the stroma plus inflammatory cells plus vessels. Next, the hyperkalemia leads to which of the following? There is a flaccid pulses. Intestinal motility is affected by the vasoactive intestinal peptide. Buffer found exclusively in the renal system is the ammonia. The receptors present on the finger tips are the Meissner's corpuscles. In hanging, sudden death occurs due to the fracture of the dentary process of exit. The following arteries lie behind the sternum. That is the thoracic artery. 20 years old young boy in the fever, headache, vomiting. He is having neck stiffness and altered mental status with hallucination. Which among the following is a brain eating? There is the Naegleria fowleri. The nascent deficiency causes which of the following affect the CNS defects? In enzymology, the term max refers to the maximum rate of reaction achieved by an enzyme when it is saturated with the substrate. The following mechanism of transport is most analogous to V max, that is the facilitated diffusion. The part of the sperm containing proteolytic enzymes to digest the zona pellucida is acrosome. The therapeutic window of the drug indicates the effective blood concentration. That rarely occurs in the 6 hours. The African lady with the eye layer infections. What could be the possible cause? That is LOA. The GVA nucleus of the vagus nerve is the nucleus solitarius. Next, 163, the structure transmitted by the foramen cecum is the Mishri vein. The ovarian cancer first metastasize to the paraortic lymph nodes. How a doctor can treat patients properly? Active listening. A needle stick injury, percentage of hepatitis B transmission would be 27 or 30%. Next, the patient having the history of the fever, cough, myalgia, he is now having the bone pain. The symptoms has prolonged to bone and there is a iliac bone mass. ALP is normal and the other tumors marker were raised. What is the likely cause? That would be the bone TB. The best investigation HLA would be the bone marrow. The vitamin K deficiency. Following factors deficiency could occur to 7, 9, 10. The denervation of the kidneys will cause the increased urine flow. The thinner space abscess, which structure will be affected? There is the first lumbrical. The young healthy patient with the nerve comorbidity after arterial stitching done, he was kept on the antibiotics and bone growth was normal, but the fluid continued to discharge from skin wound after 3 weeks. The cause would be the foreign body. Next, the while doing surgery, splenic vessel need to be ligated. They are present in which ligament? That is a lienorenal. Surgeon want to do the splenectomy, splenic vessel need to be ligated. They are present in which ligament? That is the lienorenal. The mastectomy for the breast carcinoma, the removal of the XD lymph nodes. Female develop winging of the scapula. The nerve damage would be the long thoracic nerve damage. The ileal resection done, which what made surgeon to believe it's ileum? There is a presence of lymphoid tissue with the lamina propria. So that's all from this video. Thanks for watching my video. Do subscribe my channel. Until